What's up, guys? Let's talk about some ways to make your Suboxone treatment more affordable. All right, so look, we all know that treatment can be expensive, and hold on one second. Okay, all right. So we all know treatment can be expensive, and you know, I know people who went inpatient treatment, and man, they spent probably as much money as you spend on a small house. But I mean, it's worth it if you get cleaned up and you get your life on track. Because I mean, obviously, you can have more money if you're alive and able to work than if you can't work or if you're dead. So the most important thing is getting cleaned up. But outpatient treatment can be expensive too, man. Doctors' visits can be expensive. You know, a lot of times the starting cost is expensive, the medications are expensive. So let's talk about ways we can help make it more affordable. Now, I'm just going to kind of do this off the cuff. If you have an idea that maybe I didn't think of or I forgot to say, please put it in the comments. All right, let's get started. So the first thing is for the patient with insurance. All right, let's say you've got insurance, but your medications are still expensive. It may be that you need a different medicine. So there's several medicines out there like Suboxone. Suboxone is basically two medicines. It's buprenorphine and naloxone. There are other brands called Zubsolv. There's Bunavail. There's some different options out there. And believe it or not, insurance companies oftentimes will pay for one of those, but they won't tell you which one, usually, and it's almost like a guessing game. So, it may be as simple as, let's say your doctor wrote you a prescription for Suboxone films. Well, your insurance company, you may get to the pharmacy and they say, this isn't covered, it's several $100s. But if it would have just said tablets on there, it would have been covered. Or if it would have said Zubsolv, it would have been covered. So, trying to figure out what your insurance actually wants you to be on can make a huge difference. The other thing is you may need a PA. So it may be that your insurance would cover your medicine if your doctor fills out a PA, which PA means prior authorization. Okay, so it's just like a few steps that doctors have to go through. Now, if your pharmacy says, hey, all your doctor has to do is write a letter and this medicine will get covered, that's probably not true because that's not the way it works. There's things I have to fill out or say or sign or whatever, or my office does to explain why you're on this medication, and your insurance still may not pay for it, okay? But we can try to make it work, okay? So the next thing is if, let's say, so you're on the medicine, your insurance covered it, maybe you still have a high copay. Well, there's some savings cards that you can try to help save money on the copay. And you may find these online. So go to Suboxone.com, go to the Zubsolv website, see if they have any coupons, saving cards that'll take, some of the price down. So it's going to take some work on your part. A lot of times I have these at my clinic, but I don't always. So if I'm out or whatever, I'll tell the patients, hey, just go online, look it up, print it off, take it to your pharmacy, and bam, they can do it. The other thing is there's some discount cards like GoodRx you may have heard of that can help save you money. So just start Googling how do I save money on this prescription, and you may find some codes that are completely legit that work. I don't really understand how these things work and how they save money, but they do. So try them and see if you can find something that'll help you. Now, the next is, let's say you don't have insurance, so you're paying out of pocket. Well, the cheapest thing on the market for opiate dependence and opiate addiction, I guess other than maybe methadone, is buprenorphine tablets. Now, I'm not talking about generic Suboxone here. So Suboxone is two medicines, buprenorphine and naloxone. There was an old medicine called Subutex, and most of you know all this already, but Subutex is just straight buprenorphine. There's no naloxone in it. So it's not as effective for treating addiction. A lot of people think that we only use Suboxone over Subutex because Suboxone has a blocker in it and helps prevent IV drug use. Well, yeah, that does help. But naloxone itself has some aspects to it that helps treat addiction, helps reduce cravings, And it's similar to the medicine naltrexone, which we also use for opiate addiction. Just naltrexone by itself, we use for opiate addiction, and we use for alcohol addiction. So yes, Suboxone is a better medicine for treating addiction than Subutex itself. But that being said, if cost is a huge issue, Subutex or just the generic buprenorphine tablet might be an option for you to save money. Again, not as good, but something is better than nothing oftentimes. Now, it gets a little complicated because, I don't like starting people out on Subutex or buprenorphine because it's not as good. And so I want to, people come to see me, I want to get them clean. And so I'm going to use the medicine that I think is going to be the most effective. And in most people, that's going to be Suboxone over Subutex or Zubsolv or Bunavail, whatever. Okay, so, but that doesn't mean Subutex doesn't work or won't work. And we use Subutex oftentimes, pretty much in pregnant women and in people who have like allergies to naloxone or they'll call it allergies, but it's probably not allergies. It's probably more of a reaction because you can get bad headaches or severe nausea. And sometimes people will say they have headaches and nausea, but it's because they've taken it off the street and they probably didn't take it effectively and appropriately, and they didn't have enough withdrawal time or in between their pain pills and starting Suboxone, so it made them feel sick, and they blame the Suboxone, which really they should just blame themselves or whatever for just not really taking the treatment correctly, or is just trying to kick everything else out of their system. Okay, I'm getting off on a tangent. So anyway, so Subutex might be an option, but again, like I said, I don't start out with it. And so if you go to a doctor saying, I only want Subutex, that doctor might think you're trying to divert medicine or you don't really want to get clean, okay? And so that's a problem with Subutex. And in some states, it's even harder to write. Some states do not want you to write Subutex at all unless there is like documented allergies or problems with it, okay? Some pharmacies won't fill it. Like we're having trouble getting Walmart to fill Subutex at all, unless you're pregnant. So it's a barrier. But that being said, in some places you can get it, and it can save you money if that's the right option. Okay, so other options are look around and see if anybody's doing any kind of like drug studies. And so there might be a new medicine coming down the pike for opiate addiction, and it's very possible that it's the same, active ingredients as buprenorphine and naloxone. So it may just be a different way they formulated it or a different way it absorbs or whatever. But you might be able to get into one of these protocols and have your medication provided for you for free. And yeah, it's a drug trial, so there's some risk involved. But usually when they get to those stages, it's, I'm going to say decently safe, but, don't, anyway, the risk is on you at that. But anyway, you know what I'm saying. So that's an option too. But you're going to have to do some investigating because I don't even know where they're always doing these trials. So, that's just going to take you getting online and being a little detective and trying to figure it out, okay? So that's an option too. All right. Another option is if you're stable, man, and you're doing good, and you've been on a dose for a while, consider tapering down some. Doesn't mean you have to taper off. Maybe you could just get to a lower dose. Like maybe you don't feel like, man, you're not ready to stop medicine yet because you're too scared you're going to relapse. Okay. But what if you could get to, a fourth less of what you're taking now? That's going to save you money. And if you get to a half, that's going to save you a lot of money. Okay. So like little steps along the way can save you a lot of money over time because you're talking about monthly prescriptions. So if you're saving, $20 a month, that's going to add up. All right. So little things like that can make a huge difference. The other thing is, maybe you can talk to your doctor about spreading out your visits. Or something else. Now, I personally like to see my patients every month, okay? And I'm going to do another video on people thinking that all doctors are out there for money. That's the most ridiculous thing there is. And I'll do a video on explaining why that's so ridiculous. But anyway, all right. So I'm not saying there aren't bad doctors out there. I'm sure there are. There's bad people everywhere. That's just life, okay? But anyway, it's not a conspiracy against the addict, okay? All right, so back to the focus. Talk to your doctor. Now, if I have patients who are not tapering down, I'm going to want to see them every month. I'm going to want to do periodic drug treatments, even if they've been clean for years. That's just the way it is, okay? If I've got somebody, though, who's actively weaning down and they're on a very low dose, I may spread them out every 2 months, every 6 weeks, something like that. Just, if I know, because we've built a relationship, I've been seeing them maybe for years, maybe it's just been 6 months, I don't know. They've done everything they've needed to do. I'm going to, we're going to have a pretty good trusting relationship, and I know they're going to do right. And there's lots of issues there. They can always call if they have problems. So there are patients I work with on that, but it tends to be the exception and not the rule. But again, that's one of the reasons it's so important to be honest with your doctor and build a doggone relationship with somebody that you can trust and you can have this these discussions with, and that can help save you money. All right. So those are a few ways to save you money. So we talked about insurance. We talked about if you don't have insurance. We talked about drug trials. We talked about just working with your doctor to help try to save money on your visits. And I'm sure there are other ways, man. You guys are very smart. You can figure stuff out. So let me go ahead and tell you, this is not the best way. Do not buy medicines off the street. I don't care how cheap they are. I don't care what kind of deal you're getting. It will only lead to disaster, and it screws everything else up for all the people trying to do things right. Okay? So, and that ends up driving prices up. Anyway, all right. So, I think we covered it all. Look, leave me a comment if you have an idea we didn't discuss, or if you think maybe you want more information on one of the ideas we talked about or whatever. Just remember, give me a thumbs up if you're cool with it. Subscribe if you haven't already. Guys, I'm Dr. Chris Park, and I hope you have a great day.